So non-communicable diseases are the first major killers of the world, and at this time, the world that we are in, about 80% of all the deaths in the world are caused due to non-communicable diseases.
And what we're really hoping to do here is help to clarify people's thinking about what are the problems and what are the solutions, and what's it going to take to actually implement a solution.
In Puskesmas in Jakarta, some of Puskesmas in Jakarta also has technologies in there. So actually there are so many facilities here, like we can access, but the problem is, from my colleagues' opinion, they have so many days that have so many spare time, like they don't have any patience.
With this, I am advocating a policy on healthy spaces in child development centers. Aside from institutional sustainability, a policy on healthy spaces would create a bestogenic environment through the provision of green spaces for play, promotion of healthy food selection, and organization of social food and play clubs.
We expect Kampung Champion to be independent, to raise their healthcare status over a period of 3 years by working with us. And how we plan to do that is through the medical camps and by working with them every 3 months, 6 months, 12 months, going back, developing resources, hosting medical camps, training them, and providing them with equipment.
My idea will be establish diabetes club for patients with diabetes. Why? There are so many factors which can cause patients with diabetes develop complications. In Indonesia, there are many false information about health. It's so easy to spread among people through Facebook or through a WhatsApp group. And then patients face so many obstacles to manage their diabetes condition, but they don't know how to solve this problem.
In Thailand, we also have a lot of projects or campaigns to promote activity that can reduce or control the NCDs. But the problem we got in Thailand is people with disability, for example, visual or hearing disabilities, they have difficulty access to this kind of project or campaign.
Yeah, so it's been an amazing week. I just want to tick off a couple of the things. You've engaged in panel discussions on non-communicable diseases and mental health topics. You've heard from experts. You took a field trip to the community health center. You worked with mentors to come up with collaborative project ideas to combat disease in your communities, and you presented them. And you did all that in 5 days. I hope you're as impressed with yourselves as I am with you. So you're into seeing you in the future coming back and working with us on other programs. And so for this week and for tonight, I just wanted to say congratulations, well done, and enjoy your evening. Thank you very much.
Come on!